Hello, my name is Joy. I'm a physiotherapist from Chiropractic and Physiotherapy Health Center. Today we are going to talk about pain going down the leg. This is a common cause that we tend to see from time to time, and people would come and tell you, yes, I have pain that is going down the leg when I sit, when I do this, or when I do that. So today we're going to cover the several different causes of that kind of pain. The first one to start with is what we'd call inflammation around the nerve. This is sciatica. Sciatica is inflammation of the sciatic nerve that would now give you a very, very intense pain going down the leg. The other causes that we tend to also see are what we'd call the Piriformis Syndrome. Piriformis Syndrome arises from a muscle that is next to the sciatic nerve. So the sciatic nerve is a nerve that supplies the muscles around the back of the thigh. So anything that irritates that nerve is what would give you the symptoms that you tend to experience. So the piriformis muscle is a small muscle that is found next to or even around the sciatic nerve. So most of the time when that muscle goes into spasm or gets irritated or is too tight, you tend to find it constricts and tends to put pressure on the sciatic nerve. And as a result, you tend to see pain going down the leg. The other cause, and this is mostly common for people, either you were sitting or you were walking and then all of a sudden, oops, something went, and all of a sudden now you have pain down the leg. So this is also one of the most common causes of sciatica, and maybe something that is quick to resolve because it goes away within a few weeks, hopefully. The other cause of the kind of sciatic pain, or rather the pain going down the leg, is what we call spondylolisthesis. Yes, it's a big word. Spondylolisthesis is what happens when the vertebrae of the spine become misaligned due to something traumatic, or a lot of the time it is a traumatic incident that would lead to that misalignment of the spinal bones. And this misalignment is not the minute misalignment that may happen with twisting and turning. It is something quite major, and while it happens, it would result in what you'd call pain going down the leg, because that spinal process, imagine it pressing onto the spinal canal and giving you a bit of pain. So that nerve is all of a sudden having pressure placed upon it, giving you the kind of pain we're going to have down the leg. So this is also another common symptom of spondylolisthesis. Again, spondylolisthesis could also occur without pain going down the leg. This is just a symptom of spondylolisthesis. Another cause we have is a herniated disc. A herniated disc is what we all know or have heard of. Oh, somebody popped a disc, somebody was picking something and they're back, and all of a sudden disc is gone. So disc is something we commonly hear about. A herniated disc is what happens when the discs processes that are between our bones, they're like cushions to help shock absorb the spine. So when that cushion is pressed too hard sometimes, you could find it jutting out of its original placing and pressing onto the nerve around the spinal canal. And this is what you'd tend to see. Most of the time, a herniated disc could result in acute amount of pain. This is very common, where you find someone went to pick something, they felt their back go, or they fell down, they felt the back, all of a sudden they have very excruciating pain going down the leg, they're very stiff, they're in pain, it's a very acute injury. The other kind of pain we tend to also see is a spinal stenosis. A spinal stenosis, unlike many of the other ones, is not very acute. It tends to creep in slowly. It may be as a result of a history of trauma or a history of carrying very large weights. A spinal stenosis is when the area that the nerve goes through, what we'd call the spinal canal, narrows and becomes tighter than it should be. This is common with those kinds of people who do a lot of heavy work. So there was a lot of pressure consistently put on the spine over time. And so by certain ages, or even very early on, you'd see the result of all that pressure being resulting on the spine degenerating quicker than it should be. Hence, you find with that narrowed canal, you see a lot of people complaining of pain going down the leg. That started gradually, or at some point something happened and it occurred. But when we look at our images, which is the MRI scan, you tend to see that kind of presentation. So these are the different kind of reasons why we would have the kind of pain that goes from your back all the way down to the foot. Pay attention also. It may not only be at the back of the thigh, it could also be in the front. There are very many causes, but those are just some of the few causes you could try and understand. If you have these kinds of symptoms, please feel free to go and seek medical advice. This would be able to enable you to find the cause of the pain and treat the cause of the pain, hence resolving the symptom of the pain, which is very important for your own comfort. So please go seek medical advice. You can seek your local physiotherapist or your medical doctor. Thank you.